Hello there, I'm Dr. Phil. Today we're going to be talking about breast enlargement in boys and men. Pretty common. We both have breasts, men and women. They both have glandular tissue in them as well as fatty tissue. And the glandular tissue responds to circulating hormones, and boys and men produce estrogen, the female hormone, as well as testosterone. And sometimes the levels can fluctuate a bit, particularly during puberty. And the estrogen appears to get a bit of an upper hand, which means that a lot of young boys have quite big breasts in their early teens, 13 and 14. And if you squeeze behind the nipple, often you feel quite a firm mass of tissue. That's actually glandular breast tissue that develops. But the testosterone gets the upper hand later, in the later teens, and so by the age of 19 or 20, generally the breasts have flattened out again and look more masculine. But as we get older and we get a bit fatter, our body fat produces estrogen as well, and this is why most older men tend to have slightly larger breasts. I've got a pair of moves, I call mine Eric and Ernie. They're not too bad, I just about keep them in check, but they're pretty common. Whether you need to do anything about them, I guess, depends on how large they are and whether they're causing you much of a problem. Sometimes alcohol can cause breast enlargement, so can taking cannabis, so can quite a few prescription drugs. Drugs for high blood pressure, drugs for stomach ulcers, and some drugs for psychiatric conditions. Anabolic steroids can make your testicles shrink and your breasts enlarge, so that seems like a good reason to avoid them. But often it's just fatty tissue that's making them large, and the secret probably is to eat a little bit less and to drink a little bit less, and then you might find your breasts reduce as well. If they've got to a really large stage and they're causing you a bit of pain and discomfort and embarrassment, there are a couple of surgical options available depending on whether it's the glandular tissue or the fatty tissue that's causing the problem. Before you go anywhere near a scalpel, you'll probably be thoroughly assessed. You might have a few hormone checks done, a thorough physical examination to make sure there's no other cause of your breast being enlarged. But if it's just an excess of tissue, if it's the glandular tissue, it usually means an incision with a scalpel and actually removing the glandular tissue. If it's fatty tissue, they can use liposuction, which sounds simple. It just sucks the fatty tissue away, but actually it's quite a major procedure. It's pretty painful afterwards, leads to a fair amount of bruising, and it can take 3 or 4 weeks to recover fully, so it's not something to be entered into lightly. Very rarely men can get breast cancer, so if you find a lump just on one side that feels hard as you need it against your breast, that's certainly something that needs looking into. But in the vast majority of men, you don't need any treatment. You might pop down to your doctor just to check it out for a bit of reassurance, but it's eating a bit less and drinking a bit less that's likely to do the trick. If you want to find out more, there's plenty of good information on this site. If you're considering information about any form of cosmetic surgery, the British Association of Aesthetic Plastic Surgeons, BAPS, B-A-A-P-S, they also have a website. If you want to know more about me, drphilhammond.com. Thank you.